All right. Well, I think I'm going to go ahead and kick us off and get us started as Megan continues to let folks in. Good afternoon to everyone. I'm Cynthia Randazzo, and I'm the president and CEO of the Research Foundation. And it's certainly my pleasure on behalf of our board of directors and our staff to welcome all of you today to this Zoom session to learn more about our grants, community grants program. We certainly value your time, appreciate you taking a little bit of it today to learn more about the work we're doing and how your agencies and organizations might benefit from our community grants program. So I am going to move over to the next slide, just talk a little bit with you about what the session's going to be about. We're going to talk just a little bit about the Research Foundation. And then we're going to transition to an overview about the community grants program. Certainly, we want this to be a forum where you learn more about our program. And at the same time, we want to make sure we have enough time at the end for you to have questions, and certainly screen to screen, since we're not in person, kind of that screen to screen. So I'm going to start with a little bit of background about the Research Foundation. Then we're going to end with the tour of kind of the online application. I know some of you have applied previously and are probably very familiar with that, but we do have a lot of new groups that are on today. And so let's talk just a little bit about who is the Research Foundation. Certainly, we believe that understanding a little bit about the Research Foundation and the work that we do helps you kind of understand why our focus areas are what they are and kind of our criteria. So I'm going to kind of move over to a little bit of history about the Research Foundation. I promise I'll keep it short. But we were a hospital-based foundation, certainly connected to Research Hospital and Medical Center. And that dates back to 1965. The hospital was started in 55, and it took 8 years for them to build Research Medical Center at Meyer and Prospect. And our foundation was created in 1965 after that opening. So for 40 years, our focus was to support the hospital, worked in a variety of different departments to really work to provide access to patients that were being seen at Research Medical Center. So we focused a lot in capital equipment, bringing the latest in technology to this campus. And in 2003, Research Medical Center was sold to HCA, the for-profit healthcare Corporation of America. And at that time, the Research Foundation did separate from the medical center to become an independent 501c3 nonprofit organization. We had some unrestricted funds that were invested at that time. And so those dollars basically grew within our organization. Certainly, our foundation is committed to our current programs. I'm going to briefly talk about that. But we had dollars available, and our board made the decision to look at other organizations in the greater Kansas City area, primarily in urban Kansas City, to look at how we might form some partnerships and to get some additional dollars out in our community to serve those. So we launched our community grants program in 2023 and awarded over $1 million in the first year. Average was around 33,000. Second year, we did close to 1.2 million, and average went up a little bit there, an average of a $35,000 grant. So we are certainly happy to have these resources available to other agencies in our area. A little bit about our vision. Certainly, our goal is to partner for a healthy community. We suspect all of you are also interested in the health of our community by signing up for this virtual session. We kind of have 4 areas that we continue to focus on, and I'm going to just briefly talk about those. They are healthcare students, healthcare professionals, patients, and then we do have a pretty strong injury prevention program for area youth in the greater Kansas City area. So just a little bit about these programs. We have a heavy emphasis, certainly coming from a hospital-based foundation, certainly healthcare, having enough healthcare employees, whether or not that's nursing, LPN, BSN nurses, allied health professionals, radiology techs, nuclear medicine techs, radiation therapy techs, doctor of physical therapy, having all of those students interested in those careers. We have a heavy emphasis on scholarships for those students that are interested in healthcare careers. We also have a program in the area of healthcare professionals, and we partner with Research College of Nursing, Avila, and William Jules Nursing Program to support those faculty members that are teaching nursing students. We also host full-day symposiums to educate physicians, nurses, and allied health in a variety of topics from stroke to cancer, cardiology, primary care, to name just a few. We have a few patient programs for underserved or underinsured patients, those that are insured by Medicaid or low-income uninsured, that we also support. And then certainly we have an award-winning injury prevention program for area youth that dates back to 1987 that our foundation runs. So that's just a little bit about our programs and a little bit about our organizational history. So really what you're on here for is our community grants program. And so we will have some time for questions at the end. I believe you can put those in the chat, and Megan will be monitoring those over the next 40 minutes. But I am pleased to introduce Kate Heinen. Kate's our Director of Community Grants, and she joined us in 2023. If you are a recipient either in year 1 or year 2, you have met her. She has done 99% of our site visits, so you have had an opportunity to meet her and to get to know her. And so she's going to kick off our 3rd year of our Community Grants program.
Yes, hello, and thank you so much, Cynthia. Without Cynthia and her advocacy, and of course she mentioned the board, there wouldn't be a community grants program. So we are very, very grateful for her leadership. So yeah, our community grants program for 2025 launched on Thursday. So I know I've seen some people have already kind of gone into the grants portal, and I think we already have almost 24 applications that people have gotten started on, which is exciting. So we're going to move into what that looks like. Before I move into like the eligibility and the criteria and all of that, I do just want to acknowledge that we are going to be talking about funding, money, its intersection with healthcare programming, and these are always sensitive topics, but they're especially sensitive topics right now. And so if we can just, as we move through this information, I would just encourage us all to be mindful of our breath, kind of notice how we're holding ourselves, and then just try to stay present with what comes up for us. And we'll have questions, of course, at the end. So these are our 2025 focus areas. They might look familiar because 2 out of 3 of them have been our focus areas for the last few years. So we developed our priorities after researching and evaluating community health needs and identifying areas that the board feels most closely aligned with our mission and vision. You don't have a handout on the virtual one, on the virtual meeting, but we had this a little handout that went out during our in-person launch last week. And so I'm gonna read to you the definitions for both of these. They're short, don't worry. And then they're also copy and pasted in the application. And so if you're like, oh, I would really like to read them myself, they're in the application summary. Is exactly what I'm going to be sharing. So expanding access to care, how we're defining that for our focus area. And we refer a lot to these definitions when we determine whether a program fits with the focus area or not. So we support nonprofit organizations and programs that consistently expand access to healthcare among underserved populations. We support the work of community programs that ease navigation of the healthcare system, as well as programs that provide direct care to patients. We support programs that address physical health, dental health, and/or behavioral health. And then we go on to list some examples of programs that we funded under this focus area in the past, just so you can kind of compare with your program. So some examples, kind of non-specific, are safety net clinics, direct care to patients, mobile or street medicine programs, eye exams, therapeutic support groups. Kind of get the idea of some of those examples. And we're interested in funding organizations that have demonstrated success with a history of fiscal responsibility. Programs should be experienced enough in their operations to commit to achieving measurable outcomes. That's not to say that we wouldn't fund or consider funding a newer program. There would just need to be a demonstration in the application of like why this program has come up. And then promoting health equity. We use how the CDC has historically defined health equity, which is health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. So as the Research Foundation, we recognize that historic and current system inequities have significant consequences for our community's health. We support nonprofit programs that address systemic barriers, bridge service gaps, and invest in the health of disinvested people and those who have been made more vulnerable to health disparities due to systemic oppression. So applicants for this focus area should have a program which addresses systemic inequities by serving an impacted population and by having outcomes that relate to improving health and safety. Last year, some examples of programs that we funded under this focus area were providing safe shelter to those fleeing intimate partner violence, transitional housing, resource connection or case management programs, and resettlement care. And so that gives you an idea of those few focus areas. And again, those definitions are on the application for you to easily refer to as you move through that. You might notice that depending on the nature of your program, these priorities can overlap. And we ask in the application that you choose one. And so you're going to choose the one that most fits. So spend some time with it. If the program does not directly provide any form of healthcare, then it's probably not expanding access to care, right? If the program involves getting an underserved population to a provider to provide that healthcare in another program, then that would be alleviating a barrier, right? You'd be alleviating like transportation, for example. And so that would be more in line with promoting health equity. So maybe your program fits both. A lot of programs do, but if it's not direct care, then it wouldn't be expanding access to care, just kind of as a heads up. And if you have questions about it and you're like, I could see us fitting both and I'm just not sure, definitely call or email me. You'll have my contact information because we can work through that together. And if you have multiple programs that you're considering applying for funding for, obviously we'd ask that you decide which one is in need of funding from the Research Foundation. But then you'd also want to certainly keep in mind that over the last 2 years, we've mostly funded programs that expand access to healthcare. They're both priorities. It's a big priority for us. And then if you were here the last couple of years, you might notice that we used to have a third focus area, which was engaging students in healthcare careers. The purpose of which was to fund programs that actively engage students in careers in healthcare so we can address the healthcare workers shortage. And this is no longer a focus area for our community grants program. So the Research Foundation is continuing to support healthcare students through our scholarship program and through expanding our scholarship program. So these are our two focus areas. We'll move into the next slide. Thank you. And then here is our eligibility. The expectations would be that an organization would meet this eligibility prior to applying. So organizations must be a 501c3, their own 501c3 nonprofit. So not a fiscal agent, not kind of a cohabitation, but a co-op with another 501c3. You would need to have your own 501c3 nonprofit. with net assets below $150 million. And this financial qualifier is new. We haven't had that in the past. So as we enter our third year in offering community grants, we're just observing our process, and we want to be transparent about that. We're granting maximum $50,000 awards, generally speaking. And so we're not interested in granting to organizations with net assets of above 150 million. If your organization has net assets above 50 million, but less than 150 million, you can certainly apply. You would be eligible, but you will be required to answer a question in the application that just explains your demonstration of financial need. And so we would be asking you in the application if your organization has net assets of above 50 million, why you are applying for these funds. And then for nonprofits with net assets below 50 million, there's no change. The demonstration of financial need is implied, and so there's not an additional question on the application. And then for our service area, the organization would primarily serve Jackson County, Missouri, and we have a preference on urban Kansas City, a strong preference. And the question came up during the in-person session last week. Somebody had a great question about, do you have specific zip codes that you consider urban Kansas City? And we do not. We do not have a zip code qualifier. It would just need to be KCMO, if you can demonstrate in your application how urban Kansas City is served. The closer to our neighborhood, I mean, we're over at 63rd and Prospect, but certainly downtown, midtown, what you would consider urban Kansas City. And then when we say primarily, we mean about more than half of who you serve is Jackson County, Missouri, or more than half of the specific program for which you are applying funding. And so maybe your organization is across the entire metro, but the program for which you're applying funding for would need to primarily serve Jackson County, Missouri, with urban Kansas City preference. And then focus area alignment. So we mentioned the focus areas, the definitions are in the application, and they really need to match. It needs to be clear in the application. This is how this funding will expand access to healthcare, or this is how this funding will alleviate a systemic barrier to promote health equity. We've provided the definitions and examples. If it's too much of a stretch, then that doesn't mean it's a bad or unworthy program. It just means it's not a fit. And if you're not sure whether your program does fit with the definition, you can call me and we can talk about whether the focus area fits with the definition, or whether it's just too much of a stretch and we don't see that fitting at all. Move into a little bit more about eligibility in the next slide. Thank you. So this is taken from our frequently asked questions. So what is generally not supported by the Research Foundation? So we've gone over the focus areas. This is what we're looking for. This is the eligibility. So what would not be supported? And so generally speaking, in a list, and this list is not meant to encompass all the possibilities of what may or may not be supported. All support decisions are at the discretion of the Research Foundation. But from our frequently asked questions, we have political parties, candidates, or political activities are not supported. Organizations that require or advocate religious activity as part of their services or in exchange for services. Grants to individuals, we do not grant those. International organizations, organizations that discriminate, fundraising events and activities, travel or conference expenses, single disease organizations, medical research, and then of course we added the newer financial qualifier, which is organizations with net assets greater than 150 million. And so these are all, generally speaking, not supported by the Research Foundation. So there could be exceptions, but it's doubtful and would be rare. So that's a good general list of what we are not looking for specifically. And then we'll move into talking about the awards. So like Cynthia mentioned, we have $1.7 million available, and the grant amounts haven't changed. They're the same as the last couple years. We're looking at, we encourage organizations to ask for what you need in the application. with the understanding that award amounts are going to be between 25,000 and 50,000. I think Cynthia mentioned the average last year being 35,000. And then we're still offering general operating and program support. And so general operating requests are eligible if the programming for which you're applying fits a focus area and at least half the population served is Jackson County, KC-Mo. And then we have a strong preference for programs support. And so it was the breakdown last year and the year before was 80-20. So it was 80% of our awards went to programs, 20% of our awards went to general operating. And I know the question came up, it was a great question. Someone asked last year was, do you have a preference? And so we just started sharing that, we do have a preference for program support. Keep in mind with program support that you can request 10% to go towards indirect support or go towards discretionary or overhead spending. And then the grant period is for 1 calendar year. And so it's the calendar year 2026, it's January to December, with the final report being due the end of January 2027. And then the expectations for reporting are threefold. We have an interim report halfway through the year, which I think is five questions, just kind of checking in about outcomes and what that looks like. And then we have an annual site visit. We like to come out to the programs and meet staff and do some relationship building. We're really fortunate that our board is really active, and we've had the opportunity for some board members to join us on some site visits. And I know they've really gotten a lot out of seeing the great work being done across Kansas City. And then we also have the final report, which is, like I just mentioned, due at the end of the year. And then a note on site visits is that if it's the exact same program that we funded the previous year, then there'll be the option of having it be a Teams meeting or a Zoom call if it's the exact same program. All right, so those are the awards. And so just to summarize the updates, there's a demonstration of financial need that must be stated if your organization has net assets over 50 million. Net assets of over 150 million are ineligible. We have the 2 focus areas, and we no longer have the focus area of engaging students in healthcare careers. There are 2 questions that people struggled with last year that I'd like to just touch on real quick, which is detailing the accessibility of your program services. And this is important. We have it directly related in our rubric when we're doing scoring. And so you really want to answer this thoroughly. So the question is, how does a member of the public become a person receiving services at your organization? And so that is a very different explanation than what's the buffet of services that are available to this person once they've become a client. So we want to know, how do I, just a person living my life in Kansas City, become a client? What other systems do I need to be involved with? What resources do I have to have? What must have happened to me to qualify for your services? What resources must I not have in order to qualify for your services? So all of that leading up to your intake appointment or their initial qualifier. How do they typically hear about your services? So all of that accessibility piece. I think last year what we saw a lot of was people answering the question being well, once someone starts services, this is what they have access to. And it was that's great. That's not what we were asking though. We want to know what happens before they start receiving services. So just really want to be clear about that as we talk about the application, because I know it was I'm not going to be able to go back this year. I don't think. We're expecting a lot of applications. And I know I went back to quite a few last year and said hey, you didn't really answer this. I'm going to send the application back to you and you can fill it back in. I don't think we're going to be able to do that this year. They really want us to get it right the first time. And then with outreach or with outcomes, there's a prompt to use the SMART acronym. And so for those of us who aren't familiar with the SMART acronym, it's that we want the outcomes to be specific, measurable, achievable, relevant, realistic, and timely or time sensitive. And so that's the acronym. This is also stated in the application, and I also spell out the acronym for you. But I know we have a lot of different grants that we're applying to, and so we make copy and paste our outcomes from one application to another. And I just want to be really clear that we really need that to follow the SMART prompt. And then also with that, being really clear that the outcome is an outcome and not an input. And so it's not sharing like, this is what we will be doing with the funds. This is what will be achieved with the funds. Ideally, we could state both, like this is what we'll be doing and this is what will be achieved. But we really want to see what's the outcome of this funding, what's the impact on the population to address the problem and being part of the proposed solution, which are all pieces in the application. And then just to give you a piece about our evaluation process, just in the nature of transparency, we have a staff review committee that uses a rubric to review the applications. And then from the review committee, then those recommendations go before a board committee. And then they also provide a review, and then those recommendations go before our board for a final decision before awards are made. What's covered in the rubric is extensive. I think our rubric is efficient, but extensive. And so it's thorough. That's a better word for it. It's thorough. And so we're looking at organization evaluation. So we're looking at clarity of mission, clarity of vision. We go to your website, we look at it, we look at your 990. We have a really wonderful director of finances. He provides a financial analysis using a tool to see like how historically fiscally responsible is the organization. We're looking at governance. Has there been a lot of turnover? We're looking at utilization of interns. If half their staff are interns, that makes me nervous, right? Because that means half your staff are not staff. And so all of these considerations are part of the evaluation. There's also focus area, which we mentioned. So how well does this fit the focus area? Does this actually serve Jackson County? Does this actually serve urban Kansas City? Does this fit those focus area definitions? And then a big portion of our rubric is on program evaluation. And so accessibility, so I mentioned that question in the application. Accessibility is a very important piece of evaluation because there can be a program that's really lovely and really great, but if people can't get into it, then it's not useful for us. It doesn't impact community health, which is our priority. And so we look at, is the program consistent? Is it accessible? Does it provide interventions that make sense given the population and the barriers? When we have a proposed solution that we ask applicants to state, we want to see like, does what you're doing match the proposed solution, or is it a totally different thing? Program activities need to match in that regard. We're really looking for evidence-based practices. We're not looking for experimental or kind of halfway practices. So if you have evidence-based, and also maybe even justifying your practices to your solution, there's a spot in the application for that as well. And that would also be important because you know your population more than we do. And so stating like, this is why we use moral reclination therapy, for example, as opposed to other practices for this population. And then, give us the data on why that's supported. And if you have data that spans, the country and then regionally, and then in Kansas City, this is what we're noticing, kind of that tiered data, that's beautiful. And then also anecdotal stories are also important. And so sharing, the stories of the people that you serve there's also an opportunity to provide that in the application. So those are the main updates. And we'll go into the important dates. Here's the timeline. So the application's open. Jazz hands, very exciting. The application is going to close a little bit earlier than last year. And so last year, the application closed mid-August. We're expecting a lot of applications. And we are a small but very mighty team. And it's going to be very helpful for us to have those extra 2 weeks to compile things and get things in order. We did open the application a week earlier than we did last year. So it's really kind of only a week that we're shaving off, but just full transparency, there's not as much time as last year to apply. So the deadline is July 31st. We are going to have notification of awards mid-December, and we get those checks sent out pretty quickly. Megan, who's on this call, gets those checks sent out very quickly. And then the award is for the calendar year 2026. During May through July, there's been a lot of site visits, or there are a lot of site visits. I know some of you, I feel like we just saw each other probably a week ago or a couple of weeks ago. And then interim reporting is in July. The final report is at the end of January the following year, the 2027, which feels like it will never get here, but when we blink, it will be here, which is a good thing. Maybe. Okay, and then we have, we're going to go ahead and switch it over to Megan Hartwig-Hayes with the Research Foundation, who's going to provide technical assistance in sharing about, giving a tour about the actual online application, how to access it, and what you can see. And then we'll have time for questions. So I'll turn it over to Megan.
Well, thank you, Kate. So I am going to, like Kate said, we're going to talk about the application and kind of give you an overview. We're going to talk about where to find it, the application itself, how to apply, and some helpful hints as you're going through the application. So give me a second. I'm going to go ahead and I'm going to share. All right, so as you all know, our website is the researchfoundationkc.org, and you of course found this because you registered for our meeting today. So on our homepage of the website, there is a button right here to say receive funding, submit your community grant application. So you can click on this and it'll take you to the community grants page, or you can search for it, or you can look at what we do and click on the community grants section and it'll take you to the same spot. So let's look at that. Let's go down here. Yep, community grants. So what we're going to do on this page, there are 2 spots that you can access the application. As you see right in this image right here, there is an apply here button. So it makes it super easy. You can just click this and it'll take you to the application. Also, the website has a lot of great resources, and as you all know, because you had to register on this page, but you can look at who received the grants last year. It outlines the application process that Kate just got done talking about, and the eligibility requirements, and then the frequently asked questions. So I would highly recommend you looking at those first before you reach out to Kate or anyone on our team, because there's a lot of, we add those every year as people ask questions come up and come up frequently. So that way we can kind of help each other be more successful. So under the application process, there's also create or return to an existing account. So you can click this button here and it'll take you to the page to log in for the community grants. So you go ahead and use your grant interface or Foundant login, or you can create a new account just like normal. So we're going to go ahead and log in and look at our dashboard. So this is the dashboard for the community grants. As you can see, this is my profile, our company profile, and you can see last year we've started the application process for this. This is where we've started it. And then also here's our historical requests. So you can see our application from 2024 or 2023. And also you can probably see any other applications you have going on if you're using grant interface for any other grant applications. So you can always view your application from last year. And you can print off what you've done last year. So this application packet button will be the same on this year's grant as it was last year, but you can print what you submitted last year. And you can look at previous years. So that's a great resource. So here's our current process. We're going to go ahead, and if you haven't already started the application, you're just going to click up here, the apply button. Or you can click if you've already started your application like we did, because we started it last week on Thursday for the in-person. So we're going to go ahead and click edit application. But if you haven't started, you would click apply. So what's great on this page is that you have contact information for your like the person that's filling out the application and the organization. If you need to edit any information, please do so. Something to keep in mind with accounts and profiles with Foundant is a company can only, or a login can only be associated with one email address. So if your company is sharing an email address or sharing a login, make sure that you give that password and the email, the login information to everybody that needs to access it. But you could update this. So if you've had someone change, a staff person change, you can go ahead and change that. You can also look at the status of the application. So as you can see, our application is in draft. You can see when it was last modified. So if you have multiple people working on it, you could see when it was last modified. You could also like view that application of where, and it'll show you where they modified something. And then this tab is the documents tab. So you will be able to see all of the documents that you have uploaded to your application. So this is the top part. Now you can also copy over your candid profile. You can copy over previous answers from previous year. Make sure if you do that, make sure you read your answers and edit them so it applies to this year's program. Now there's two different buttons right here. There's the application packet. And like I said, when we were viewing last year's application, this is where you're gonna print a PDF of what you've submitted or what has been drafted so far. Also, this is a question list. So this is actually the handout that we used in the in-person meeting, but the question list is just a blank application. So it gives you, so if you want to share it with your team before you all start applying, and you could divvy up the different parts or whatever, you can view everything ahead of time before you actually start in and editing everything. So the application is in different sections, just like it was last year. And we have the organization information, program, grant details, grant contact information, attachments, and then the program information that you're going to be putting in, and certification. And so we'll walk through a couple of these to kind of give you some hits and tips. But I do want to show you down at the bottom, there's a save application. So you can save it, come back to it, save it, come back to it. You have to click the save button in order for all your information to save. Now, if you accidentally exit out, it doesn't automatically save. So just save often is what my recommendation would be. And then this would be the submit application button. So you can submit when you're ready, when you've proofed, you've done everything, you've uploaded everything, you're ready to submit. This is where you would push that button and it will submit it and send a notification to your email that it's been submitted. And then you can also go up here and see that your request has been submitted. So if you have any questions, and then you can see where we're at in the process. Now, if you get into the application, you start filling it out and you're like, I just don't think we're a good fit for this application. You can always abandon the request. So that way it just lets us know that you're not interested in applying. So for instance, if you draft one and you're like, we're good, go ahead and abandon the request instead of just leaving it drafted, because that lets us know, hey, you're not going to apply, and we won't do any follow-up to make sure we get that application taken care of. Or if you get into the application and a cat walks across your keyboard and there's just too much to fix, or things get really off or wonky and you just want to start over, you can always abandon the request and start over. All right, we're going to kind of dig into the actual application. So we have the organizing information. So this is all the information that Kate was going over that you all can see here and read and review. So it talks about the process. It has all those important dates, the geographic area, the status, the assets, the focus area, and the support types. And then you're just going to fill in your information. So please make sure anything with an asterisk is required. Also, each section that has a little more space for you to write has character limits. So make sure that you do good wordsmithing, keep track of your characters. It includes space and punctuation. Sometimes what I do is type everything up in Word, count my word, and then copy into the application with a plain text, like paste as plain text. So that way you're not seeing any hidden characters or anything. So that has happened in the past. But it'll count down for you, so that way you can see how many characters you have left. And then the next one is the community grants details. So this just says you have to submit this online and where to save your PDF. And you have to submit it. And if you have any questions, here's Kate's information. So we try to really, when in doubt, if you've tried it 4 or 5 times, it's not on the frequently asked questions, please reach out to us. We're here to help. And then here's your grant contact information. So this is a main person that's going to be filling out the grant, and also your executive director's information. The attachment section includes an IRS letter of determination, a board list, organization budget, program budget, 990. An audit isn't required, but it's encouraged. Financial statements, which include the financial position and statement of activities. An organization logo, that is what we're going to be using for any promotion if you're awarded grants. So make sure that you upload it. And then any other photos. So I'd really encourage you, if there's a photo of your organization that really captures what you do, it's a great way to be able to share some visual representation with your application. Something to keep in mind in this attachment area is that the attachments have limitations, and each section you can only upload 1 file. So for example, the financial statements, that you have 2 different sheets that need to be submitted. So you'll have to combine them in a PDF and submit them. There's also a limit on the size of the PDFs, so I would highly encourage you to watch that. And I use Adobe Acrobat. It's a free PDF compressor. So if you ever want to compress something, or even like if you want to upload your annual report or anything, those are big documents. So you can compress it here. You just search Adobe free PDF compressor. And I use it all the time with board booklets and different things that I'm sending out to make sure it doesn't get bounced in emails or meets the requirements for the uploading. So keep in mind, another thing I would like to point out in this section is the 990 form. I know some organizations aren't required to submit a 990, but as you can see, it's asterisk there. So what we would encourage you to do is show us, you usually get a postcard in the mail, or you have some sort of documentation from the IRS saying, hey, you don't have to fill out a 990. So upload that information so that way we know. Additionally, you could look at a 990 and send us, attach a document with that information in it, because that information is really key for our evaluation process, both of your program and your organization, but also your financial side, and is used. So that information is very valuable. So make sure you upload your most recent 990. And if you don't have one, upload a card showing or the information that would be submitted with that. And then the last section is the actual meat of the application. So it talks about your type of request, and then a priority alignment, and then the population you're serving, the community need, the proposed solution, goals and anticipated outcomes. That's where Kate was talking about the SMART goals. Be very specific in that area. And then any additional information. So if there's anything else that you want to share about your organization, that would be helpful in our decision process. Finally, the certification is where you're going to certify that everything is best to your knowledge and everything you've uploaded is your organization. and then you'll submit. And you just want to make sure that you get that email that you've submitted. And you can always look up at the top that your request has been, it'll say submitted right here. So I believe that is everything with the application. Once you're done, you can always go in, like I said, and print your application packet. So that would be the completed, that includes the answers that you submitted, or a blank one for your questions. So I'm going to go ahead and turn it over. I think we're going to go ahead and open it up for questions. So I'm going to.
Yes, we're gonna open it up for questions. I do want to ask, because this is a recording. There were a lot of people who couldn't join us today, or who are going to refer back to the recording. For questions that are specific to your program or organization, please call me or email me so we can discuss those. If you have general questions about what we discussed today, this would be the time to ask them. Look at the chat real quick to see if we have a question hiding in there. Yes, those items in the chat, accessibility of program. Yep, those questions are all in the, so Lisa had a question in the chat, if we could list those points regarding the accessibility of program services. And the question in the application has those questions listed. I was mostly just highlighting them today. So they're not necessarily new, but those questions are in the application saying, like, look at accessibility of programs, and then all these different questions that I mentioned today to kind of jog that process. Because I know a lot of us are not used to talking about how our programs are accessible. We're used to talking about how great our programs are and what they offer. And so it ends up being a little counterintuitive for us. So those questions are in the app to help us along. And then I see Coneflower Consulting for the focus area this year. I just wanted to double check. Healthcare education or workforce training programs, etc., is not a priority area for grant funding. Is that correct? That is correct. That is not a focus area for us this year. In the past, we've had 3 focus areas, which included that, and this will be our first year in which we will not have that as a focus area. And I see Michaela's question. Oh, thank you, Megan. Megan also copied and pasted from the application about the accessibility question. Okay, Michaela's question. Would you consider a more grassroots type of organization, or do you heavily lean towards well-established long-term programs or organizations? That is an excellent question. It has been tricky to determine our own trends, just because this is only our 3rd year. So we haven't been a community grants program for a super long time. So as far as like, here's what we've done for the last 10 years, we don't really have that. And so we are also kind of learning what our own trends are. We do have a preference for organizations that have demonstrated success. And so grassroots, I know, can be such an umbrella. And so if we have an organization where, like, we just started doing this programming in the last year, that would be tricky to show that, like, that's a demonstrated success with this program, right? But there are also organizations that are more like quote unquote grassroots, that have been doing this programming for a while, and they have some demonstrated success that they're able to articulate in their application. And so we would certainly consider that. There's an application that we funded fully last year, an organization that we fully funded last year, who's been around for 6 years, or 6 or 7 years, which is not a very long time considering many of the nonprofits in Kansas City have been around a lot longer. So yeah, to answer your question, I feel like I kind of digressed, but we would consider it. It would just be a matter of demonstrating in the application the need, the proposed solution, why this solution works, And that would just be the most important thing. We're not dismissing grassroots organizations.
It looks like there's another question from Samantha that said, is there a preference for the research foundation on the age of the organization?
Yeah, that's a good question. I haven't done an age analysis of the organizations, thought about it, but it's mostly just however long they've been able to demonstrate success with their program. Or keeping in mind that new programs are not a disqualifier. And so if an organization's like, hey, we've been serving this population for several years in this capacity, and then we've decided to start a 501c3 around it and launch a new program, like that would be something that's very new, but it wouldn't be disqualified. We do have a preference just because it's easier to assess. Organizations that like we can see where they have a program that's like they've made changes to it, it has outcomes that it's able to meet, it's sustainable, it has capacity. And so I would say like there is a preference for that. But you know, some organizations have been around for a long time and are still kind of figuring it out. And some organizations are newer and are just like they hit the ground running with the plan and they've done a great job and they're quote unquote newer organizations, right?
There's another question from Christina at Casey Care. She says, to confirm, organizations with net assets over 150 million are not eligible.
Yes, to confirm, organizations with net assets over 150 million. And if we need a qualifier for what do we mean by net assets, we're really looking at, I think it's line 22 of the 990, which states it might be line 21. So there's that series where it talks about assets in the 990. And yes, organizations with net assets above 150 million are ineligible to apply.
I don't see any other questions we haven't answered. Anyone else have any more questions?
Do you have any lingering ones that are general? Well, I will say my turnaround time for questions that I get emailed, I try to get back with people within 2 business days. So either that day or the next day. So if it's been 3 days and you're like, I sent Kate a question and I haven't heard back yet, reach out again or call at that point, especially if you send it via email. I know sometimes things get lost, and I know last year there were a couple people who were like, I sent a question a week ago and it literally just got lost. And so please know that that's my turnaround time. And so if it's taking longer than that, I want you to call and leave me 2 voicemails is fine. More than 2, and I'll be a little annoyed. How soon will the recording of this meeting be available? We're going to get it out this week. Maggie, our director of marketing, is fabulous. She's on vacation today, but she will be in tomorrow, and I think she's gonna try to get it put on the website probably by Thursday. That's what I'd imagine. And then Mallory has a question regarding serving primarily 50% Jackson County. Do they need to be Jackson County residents? Can they be served in Jackson County? That's a great question. We have a preference for, it depends on the population, I'll say. And I know how unsatisfying that answer is, but like, it depends. But also it's the truth, because if we have a transient population or a population that maybe doesn't have an address, them just being served in Jackson County is golden. That's perfect, right? We do have a preference for residents of Jackson County and urban Kansas City. And I also want us to be mindful that if it's not quite 50%, there are ways that you could apply a grant award to just be serving Jackson County. So I'm thinking of, and I'll just name them, like Gilda's Club is an organization where like we're not a fee for service grant. We just give the money and then we trust that you'll spend it accordingly. And then we ask you to report on spending it accordingly. But like Gilda's Club is one example. There's others that we've served or that they're providing services that we've awarded funds to, who they serve across the metro, right? But they are only applying funds from the Research Foundation to people that they serve who are residents of Jackson County. And so, because it just fluctuates so much how many are residents of Jackson County and who are not. And so they make that really clear in their application. So we're not wildly strict on the 50% piece for a program. We would be really a lot more strict on the 50% piece, or a lot more rigid, I should say, for general operating support. If you're seeking general operating support and you serve across the entire metro and you're really not sure if over half are for Jackson County, you might want to apply for program support, and then illustrate in your application how you would apply the funds to just benefit those who are in Jackson County. Did that answer that question? Okay, good. Thank you. And if you have questions about that, like I really am available. And so you can call me and we can talk about it.
Okay, we are at the magic hour and kind of want to wrap this up. I want to thank Kate and Megan for their work today. And I want to thank all of you on behalf of our organization, your willingness to be on the call to learn a little bit more about our community grants program. It's certainly a partnership of ours to work with those doing outstanding work in our community in these two areas. So thank you for being with us today. And I believe, Kate, let me know if I'm wrong. I believe Maggie will send out a link to all of them. Is that correct? With
Yes.
the recording, anybody that has signed up for in-person or virtual.
Yes, it will be sent out and posted on the website under the community grants page.
Super, super. All right. Well, enjoy the rest of your week and this beautiful weather.